So here, let me talk about the cardiac glycoside. This is cardiac medication. Particularly here, I am explaining digoxin. The cardiac glycoside we use for treatment of atrial fibrillation or atrial fluttering, or if the patient have a congestive heart failure, we use the cardiac glycoside digoxin. What are the generic drugs name as cardiac glycoside? Example is digoxin or digoxin. The mechanism of action of digoxin, basically nobody really know accurate how digoxin works. However, there are many theories. The action, some books said, they increase the force of the heart contraction, which can be beneficial in the heart failure and for irregular heartbeat. The effect of digoxin over the heart, they slow down the heart rate and increase the blood pressure and increase the tissue perfusion. What are the other use of digoxin? We use to relieve the heart failure symptom, especially when the patient is not responding SC inhibitors or digoxin or diuretics. Also slow the certain types of irregular heartbeat like arrhythmias or particularly atrial fibrillation. So there are some very important nursing education or implication. Before give digoxin, we could monitor the apical pulse for 1 full minute. Always take an apical pulse hold if heart rate is less than 60 in adult and less than 100 in infant. Some books said less than 90 in the children and less than 70 in older child. But I said less than 100 in infant as well. So what NCLEX note here? The therapeutic level of digoxin is 1 to 2. If greater than 2, the client is digoxin toxic. The sign and symptom of digoxin toxicity, like the client will see the yellow spot or nausea, vomiting, and abdominal pain. We call GI symptom. What are the central nervous system? Patient complain headache, fatigue, and lethargy. In case of cardiovascular system, we see bradycardia or dysarrhythmias. Ophthalmic, we can see the flashes of light or client will see yellow spot. What we need to know for board exam, the warning sign of toxicity in infant and children is bradycardia, right? So if you see the patient have a digoxin toxicity, we give them antidote. If patient is toxic, give the activated charcoal or digoxin fab. Toxicity may be treated with gastric lavage, activated charcoal, or digoxin fab. Some books say disband, which is antidote of digoxin toxicity. Now, when your patient take the digoxin or digitoxin, we could monitor their electrolytes. Patient chance to develop hypokalemia, hypomagnesemia, but hypercalcemia. So if patient, when we monitor, patient must monitor the potassium level, because low potassium level can increase the risk of digoxin toxicity. So potassium level monitoring is super important. Low potassium can increase the chance of digoxin toxicity. What else? What are the EKG change occur? So in this picture, we can see the normal EKG where showing the P wave, QRS, T wave, P wave, QRS complex, and ST segment. This is positive deflection, you see, up direction, up direction. But if patient has a digital toxicity occur, we can see ST segment here. In this picture, compare with this one, this is upright direction. But here ST segment is down direction, downward, negative deflection. Here is a positive deflection. So the curve ST segment or ST segment depression is typically we found in digoxin toxicity in EKG or ECG. So if your patient undertaking the digoxin toxicity, they have developed the sign and symptom of toxicity, and you tell them to take EKG, and EKG we found ST segment depressed, curve, not look like the normal. What is the positive deflection, upright deflection? It indicates patient has a digoxin toxicity. Here we go. How to recognize digoxin toxicity and common symptom and sign. Patient has a common arrhythmias associated with digoxin toxicity. Maybe they have a bradycardia, and bradycardia is the warning sign of toxicity in infant and children is bradycardia, as I told. Sometimes bidirection ventricular tachycardia or regularization of atrial fibrillation or paroxysmal atrial tachycardia with blocks.